Good afternoon, folks. Good afternoon, folks. Today's discussion A deals with the part of dementia that people wander around the house or their rooms. We're going to discuss wandering for today for discussion A. So please join me in the presentation I made today for you. So here we go. Here are some of the most effective strategies for preventing dementia-related wandering drawn from the article. And the title is Dementia-Related Wandering, What Caregivers Need to Know. Okay. Prevention strategies for wandering. Technology-based solutions. GPS trackers, wearable devices that help locate individuals quickly, alert systems, door alarms, motion sensors, and smart home integrations to notify caregivers of movement. Okay, 2, environmental modifications, secure entrances, install locks or door sensors to prevent unnoticed exits. Visual cues. Use signage or color-coded paths to reduce confusion and promote orientation. Okay. Camouflage techniques. Cover doors with curtains or materials to discourage exit seeking behavior. 3, routine and reassurance. Okay. Consistent daily schedule reduces anxiety and disorientation. Comfort items, familiar objects, or photos can help soothe agitation. Verbal reassurance, gentle reminders and calming communication to reduce stress triggers. Community alerts. Register with local programs like Silver Alert Systems. Neighborhood awareness. Inform trusted neighbors about the situation. Would you like to explore how these strategies could be adapted for frailty aware or culturally responsive care environments? I'd be glad to co-design a framework with you. Caregiver support. Caregivers supporting individuals with dementia face a constellation of challenges beyond wandering. Drawing from the article and related context, here are several interconnected issues. Related challenges for dementia caregivers. Emotional and psychological strain. Consistent vigilance. The The unpredictability of wandering demands round the clock attention. Anxiety and burnout. Fear of a loved one's getting lost or injured can lead to chronic stress and caregiver fatigue. Communication difficulties, cognitive decline, impaired memory, and language make it hard to understand needs or reassure effectively. Behavioral symptoms, aggression, confusion, or resistance to care can complicate daily routines. Safety and environmental risks, home hazards, risk of falls, injuries, or unsafe exits increases with the disorientation. Emergency preparedness. Caregivers must maintain updated care plans and be ready to respond quickly. Social isolation. Reduced social engagement. Caregivers often withdraw from social activities due to time demands or stigma. Okay, limited support networks. Many lack access to culturally responsive or community based resources. Financial and logistical burdens, cost of care, expenses of for technology, home modifications, and professional support can be overwhelming. Housing and instability, raising rising costs, and limited accessible housing options for seniors with dementia related conditions. Intensify stress, especially for older caregivers. Would you like to co develop a framework that integrates these challenges into a culturally responsive, frailty aware support model? We could also explore participatory strategies to strengthen caregiver resilience. Great question. Drawing from both the article on dementia related wandering and your document on caregiver challenges, here is a synthesized set of strategies to support caregivers, especially those navigating frailty aware, culturally responsive care environments. Effective strategies to support dementia caregivers. Strengthen emergency preparedness. Develop personalized care plans with medical info, photos, and contacts. Register for local alert systems, e.g., Silver Alert. That's for elderly folks when they disappear, guys. That's a system that the local people use to find an elderly person. Okay. Um, Train caregivers in rapid response protocols and community coordination. Okay. Combat social isolation. create peer support groups tailored to cultural and linguistic needs, promote community based respite programs and integrational engagements, use virtual platforms to connect for connection when mobility or stigma limits in person interaction, ease financial and logistical burdens. Advocate for uh, subs, subsides or grants for home modifications and assistive tech. Connect caregivers to housing and navigation services, especially for older adults. Offer flexible work arrangements or caregiver stipends through policy reform. Enhance emotional and psychological support. Provide access to counseling, mindfulness programs, and stress management tools. Normalize caregiver grief, guilt, and burnout through public education. Train professionals in trauma informed and culturally sensitive communication. Five, build culturally responsive infrastructure. Co-design interventions with caregivers from diverse backgrounds. Translate materials and adapt messaging to reflect cultural values and caregiving norms. Partner with face, partner with faith, faith-based communities, faith-based and community organizations to extend reach and trust. Would you like to co-create a participatory framework that integrates these strategies into your anemia intervention work or frailty aware models? We could also explore how to measure caregiver well-being across cultural contexts. Okay, to implement caregiver support strategies effectively, especially in dementia care contexts like wandering, we can translate the recommendations from both the dementia article and your document on systematic interventions into actionable community based models. Practical implementation of caregiver support strategies. One, emergency preparedness. Local local integration. Partner with emergency services to create dementia specific response protocols. Okay, community mapping. Develop neighborhood networks where caregivers can alert trusted contacts if a loved one wanders. Digital tools. Distribute GPS enabled wearables through public health programs, social connections and respite, culturally tailored culturally tailored support groups, facilitate peer circles in community centers or faith-based venues, respite co-ops, organize time uh, banking systems where caregivers exchange support hours, virtual engagement, use telehealth and online forums to reduce isolation and share resources, financial and housing support, policy advocacy, push for caregiver uh, stipends and flexible work protections through local legislation. Housing navigation services embed uh, social workers in clinics or aging services to guide caregivers through housing options. Micro grants offer small scale funding for home safety upgrades or assistive tech. Emotional and psychological support, mindfulness and counseling access, integrate mental health services into primary care and community health hubs, public education, and public education campaigns, de- destigmatize caregiver burnout and grief through storytelling and media outreach, trauma-informed training, equip professionals with culturally sensitive communication skills. Culturally, culturally responsive infrastructure, participatory design, involve caregivers in co-creating materials and interventions that reflect their lived experiences. Multilingual resources, translate guides and signage to reflect community languages. Faith and cultural partnerships, collaborate with trusted institutions to extend outreach and build trust. Would you like to sketch out a pilot model for one of these strategies, perhaps integrating it into your anemia intervention or frailty aware care framework? We could also build a logic model to guide implementation and evaluations. Community mapping is a powerful, equity driven strategy that helps caregivers and health systems respond more effectively to challenges like dementia related wandering. Here's why it's also important, especially in the context of frailty aware, culturally responsive care. Why community mapping matters for caregiver support. enhances emergency response, identifies safety zones, trusted neighbors, and local resources that can assist if a person with dementia wanders, enables rapid coordination with community members, law enforcement, and health services. Okay. 2, builds localized support networks, maps informal caregiving hubs, faith-based institutions, and culturally relevant gathering places, strengthens local ties, and reduces caregiver isolation by connecting people with shared experiences, involves resource allocation, reveals gaps in services like respite care, mental health access, or housing support within specific neighborhoods, guides micro grant distribution and infrastructure investment where it is most needed, supports culturally responsive design. Okay. Caregivers' lived experiences and caregiving norms across diverse communities, informs participatory design of interventions that reflect values, languages, and caregiving practices, empowers caregivers and communities, shifts power dynamics by involving caregivers in shaping their environments, encourages collaborative problem solving and advocacy for systematic change. Would you like to co-design a community mapping toolkit tailored to dementia care and caregiver resilience? We could include participatory methods, visual templates, and policy integration strategies. That is A for you. I will be back on with B shortly. Give me a bit for B, please, and I'll be back on with you. For now, Gator Wellness, take care, folks.